As coronavirus cases jump and deaths surge in Italy, new figures show an enormous level of contagion among the country's medical personnel. At least 2,629 health workers have been infected by coronavirus since the onset of the outbreak in February, representing more than 8% of total cases, according to a report published on Wednesday by Gruppo Italiano per la Medicina Basata sulle Evidenze or GIMBE, Italy's group for evidence-based medicine. The data has sent shock waves through the country's already strained healthcare system. We extracted this number from data provided by the National Health Institute, GIMBE Director Nino Cartabellota, a public health expert, told Al Jazeera. Figures regarding the contagion among doctors, nurses and general health professionals have started being disclosed only on March 11. Hundreds of new cases have been daily recorded since then. But medical personnel on the front line should be the first one to be protected. Cartabellota said that the actual number was likely to be higher because healthcare workers are not always tested and protection measures at hospitals were inadequate. Many who tend to coronavirus patients are still only using surgical face masks with no proper protective filters to shield them from contagion. The percentage of health workers infected in Italy is almost double the number registered throughout the epidemic in China, where more than 3,200 have died. According to figures published in JAMA Network Open, an online medical site from the Journal of the American Medical Association, infected medical staff in China made up 3.8% of the total cases, with only 5 deaths. Over 60% of the medical staff who were infected were registered in the epicenter's outbreak, Wuhan. Italy is the worst-hit country after China. On Wednesday, Italy announced that over the past 24 hours, the number of deaths had risen by 475 to 2,978, an increase of 19%, as cases jumped to a total 35,713. There are no official figures on the number of medical personnel who have died of coronavirus in Italy. According to Italian daily Corriere della Sera, a general practitioner from the province of Lodi died on Wednesday. This raised the death toll of family doctors in the area to 4. Other regions have also registered losses among medical staff. A lack of equipment, resources and personnel has piled pressure on Italy's health system. Italy does not produce masks. With the pandemic spreading, some of its closest neighbors have been reluctant to export supplies they may need soon. The problem right now is the supply of the protective gear, Cartabellota said. The government should have thought of this some time ago. It is logical that following the global explosion of the pandemic, countries producing masks and other protective devices are now keeping them to themselves and stopped their exports. We already have a limited number of doctors and nurses. Under extreme circumstances, we could even ask them to keep working even if they tested positive for coronavirus. Still, they should be equipped with protective devices to avoid spreading the virus further. An emergency decree presented by the government on Monday allocated €3.5 billion $3.8 billion towards the ailing health system. We are importing medical personnel from abroad and throwing new young healthcare professionals without licenses into the fray, Cartabellota said. If we don't provide them with adequate protection, it will end up like in a war where soldiers don't die while fighting on the battlefield, but because of lack of equipment. The more medical personnel is infected, the weaker the responsiveness of the healthcare system. Thank you for watching. Please don't forget to like and subscribe to my channel and please click on the bell so you will be updated on my next video. Thank you. WeCare for you PH. Your health comes first.